Hey everybody, John Schumacher here with New Wave Healthcare, where digital health companies come to share their stories. And today I have Nick Dougherty, who is the CEO of Verbal Care. And Nick and his team are out to improve the patient caregiver communication realm in healthcare through the use of technology. So Nick was kind enough to come on today and talk a little bit about his company, the background of his company, what products and services he has on the marketplace, and a little bit about his personal background. So Nick, hey, thanks so much for coming by today and sharing your story with us. Let's just have you just tell us a little bit about your personal background. Do you have a medical background? And then we'll jump into your business.
Yeah, thanks for having me on, John. Excited to be here. So, my name's Nick Dougherty. As you got the pronunciation right, which is great. Most people say Dougherty, so this is great. So, background about myself. My background is in computer engineering. So, I didn't truthfully come from a medical background, but I grew up in Boston. I've been to the hospital more than my fair share of times, being one of three boys. My poor mother and us always seemed to be in and out of the hospital. But really, the background is in human-centered design and engineering, and being able to create great products for people that make their lives better. I mean, that's really what gets me into this.
Right. Yep. And so and you guys are doing that too in the communication realm in healthcare, and that's just a big problem. So let's just do this. Let's say someone walked up to you, Nick, at a supermarket or something, and asked you what you did, and you said you had a company called Verbal Care,
Yeah.
and so they asked, well, what is that? What
Mhm.
would you tell them? What's your elevator pitch for your company?
So I would say what we do is we improve the patient experience at the bedside. And I think we do that through communication. And sort of where we really start is with the problem. And the problem is that patients don't really have a great mean of communication in a hospital bed, in a nursing home, and even if they're nonverbal, that's especially tragic for them. So let's say that you're in a hospital bed, you have a trach in your neck, and it's starting to fill up with your own saliva. You're having difficulty breathing. How do you alert the nurse that you're in need? You push this call button, and it can only do one of two things. It either turns on or it turns off. It's the same button for I need a glass of water and I can't breathe. This is a serious problem. And it's difficult for a nurse to prioritize which request to go service. So here I am lying in bed, choking on my own saliva, and the only means of communication is a push button that turns a light or makes a sound. We think that's a problem, and what we do is we put a tablet at the bedside. It's got picture-based menu icons that allow you to select exactly what you need. So you can say, help me, I need my neck suctioned, and the nurse arrives providing the care that you need at the time you need it. So I know that wasn't a very elevator pitch. If I were to sort of say that over, it's we do point of care communication and care management for hospitals. That's really the core, but it's so much more than just communication. It's about improving the overall patient experience.
Right. And that is important too. I know I've worked at skilled nursing facilities before, and like you say, there's only one button that sits on their stomach. Hopefully it falls off the bed half the time. They have
Yep.
no way of alerting the nurse that they need have a problem, and there's no way of differentiating whether it's an extremely important problem or an issue that needs immediate help versus someone who just wants the TV channel changed. So there's really no way to do that. So your guys' iPad service would allow there to be like severity differences in how the patient connects with the nurse, or what is that?
That's right. That's right. And that's one of the reasons why we actually just recently changed the name from Verbal Applications to Verbal Care. It's because it's really a care management platform. So when a patient makes a request on any tablet device that's hosting a verbal application, their request gets sent to the appropriate care professional. So instead of, like a glass of water doesn't need to go to a registered nurse. That's something that could go to an aide and be able to they can come in and take care of that request. And whereas something like I am having difficulty breathing is probably something that you want an RN to head straight in for. So it's really about providing the best care for that patient at their time of need. And it helps eliminate some of the wasted steps that nurses have to take, and sort of the unknown of what's waiting for them on the other side of the door. We just ran this survey where we surveyed over 100 nurses anonymously, and we asked the question, how often do you know a patient's need before arriving at the room? And, always was, less than 5%. So they hardly ever know what a patient needs coming into the room. So it was really shocking that you had, sometimes and never, rounding out the majority, like pretty much 2/3 of what a nurse knows. So you really have a problem here. Nurses should know what a patient needs prior to arriving.
Right. And then it helps them maximize their time and prioritize their time, their productivity, their workflow, and everything. So that's a huge asset to be able to know what you're going into, how important things are, how to prioritize what action steps need to be taken for you as a health provider. That's something that I know that some of the facilities that I've worked at, they don't have anything like that. I mean, nurses are being called to bring someone a glass of water sometimes and things like that. So definitely not the best use of their time, so I think it's pretty cool. So I think you painted the problem pretty clear, right? I mean, there's just a lack of communication and a lot of time wasted in these facilities, and you guys are out to address that problem. What inspired you to go after this problem? I mean, did you have a personal, a family member or somebody who had a poor communication experience, or what motivated you to actually build a company around this problem?
I think it was a collective sort of thing that brought us to this point, but I'd be lying if it wasn't saying that it was our senior design project at the College of Engineering of Boston University. That's really what kicked it off for the co-founders. And how that project works is that you get to choose from a list of topics. And those topics could be design the next generation of smart lighting to our project, which is design an iPad application for post-stroke patients in the ICU. So it's very specific. Design an application for post-stroke patients, specifically patients with aphasia, so loss of language, really, but not intelligence. So the first thing that we did was get on the phone, and we're like, okay, we're going to call the best hospitals in the country and understand what happens, how do they deliver care to post-stroke patients. So we got on the phone, we called the first group that we called was Mass General Hospital. And we asked, hello, Mass General Hospital, would it be possible for us to shadow your stroke ward nurses? And they said yes. So we put on the scrubs, we went into Mass General Hospital, and we started shadowing their nurses. And we identified two things immediately. And the first thing was that there's no way that you could design one application to be able to communicate for all patients, because everybody is so different. So we needed to create a platform that could be personalized for each patient. So that's really where the platform idea came from. And then the second thing that we noticed was that nurses were inefficient, but it's not their fault. Nurses are incredible at what they do, but there's systemic communication and workflow issues there that are just getting in their way. And we think that technology can be a great way to improve that, not to hinder that. Because I think technology to this point has really hindered the way that nurses do work. It takes away their time from patients. And I think that we can do a much better job of improving their overall satisfaction in the workplace by making them more efficient organically. So that was really the second thing that we noticed is we want to improve the workflow for patients and nurses.
Right. And so you already touched on this a little bit, but go into more depth as far as the solutions you guys are providing. I mean, we've clearly, I think, stated the problem, inefficiencies, not knowing what you're going into, all kinds of issues within the healthcare field as far as nurses and taking care of patients. But can you kind of elaborate on the solutions you guys are providing, again, for those problems?
Totally. So the core solution is our verbal care patient platform. And what that is, it's this cloud-based system that a hospital or a nursing home or assisted living facility is able to purchase. They put tablets at the bedside. So it's either mounted at the bed, wall mounted, IV pole mounted. It's really up to the institution what they want to do. And for the patient, what they're experiencing is a personalized care management platform. So you have these picture-based icons that are totally specific to you. So let's say that you're a diabetic patient. You have a certain menu option to choose from. The food that's at your fingertips is going to be food that is specifically tailored for you. So it's not like, you have totally sugary foods there to order and then have somebody say, no, you can't order that. It's really about creating an experience that's going to be best for you in your care. But let's say, there's a more fun example than that one, that you want to be able to talk with certain family members. So we can upload pictures of your family and have encouraging words. So maybe even if they're not there, you have the ability to select and be able to interact with them. But really this idea is that you can personalize the experience for each patient. Then from sort of a more tactical standpoint, for a clinician, they're able to understand workflow in real time. So from the nursing dashboard, you can see what requests are currently being taken care of, which requests are currently outstanding, and which rooms have no requests. They've already been taken care of. So you can get sort of this 30,000-foot view of everything that's going on, which is great for administrators and really great for nurses that go in between, or aides that go in between different floors. So you can say, this floor and this ward has a ton of load right now. Let me go transition and go spend my time over there. And it's also an opportunity for us to gather a lot of data and be able to understand, what are patients requesting? How can we anticipate their needs? So let's say that a patient always asks for their lunch at 11:45 every day. And then at 1 p.m., they always go to the bathroom. They always ask to go to the bathroom. And let's say that this patient is predisposed to fall out of bed because they may be injured. And one of the biggest pain points for hospitals is falls, and really any facility. It kills a ton of people. So if we can prevent falls by anticipating that this patient is going to ask to go to the bathroom at 1 p.m. after being fed, then we can preemptively provide care. So that's what's really exciting. As we start to get more data, it goes really from this patient experience, providing really custom tailored solutions at the bedside, to being this predictive, preemptive care modeling tool.
Yeah. Yeah, so it's almost like not only a communication tool, but a remote monitoring, almost like a preemptive type of issue there, that you can keep tabs on people's patterns and habits and use that data to help make them safe, and that's pretty cool.
That's right.
So what's the market size like for your guys' business and product? Can you touch on that?
Yeah, I mean, really, I've touched on it a little bit about who we're marketing this to, but I would say the first market is really the hospital market for us. There's 924,000 beds in the U.S., and I know it'd be crazy for us to say that we're going for all 924,000. I think we're specifically focusing on medical surgical beds. So the med-surg units are big for us. OBGYN, rehab, orthopedic, a lot of these sort of long-term type stay environments where there's some acute needs, but also the need for concierge type servicing. So we're not really targeting emergency departments at this stage. But our initial target is really these long-term post-acute type environments.
Okay, so a big market then.
Yes,
we'll just say that. Huh?
Yeah, we're definitely taking a platform type approach because it is a big market.
You're not going to run out of people to try to service there. So what about like funding for your company? Can you talk about kind of the process you've gone through to get your seed funding?
Yeah, so we were in the Startup Incubator Mass Challenge over the summer, which is a great startup incubator. I think you still have a couple weeks to apply if you're looking to start a company. It's a great resource. We met a ton of angels through that experience. So we had the opportunity to really get to know the VC and angel community within Boston. And that's really where a lot of our initial funding came from. So we're really fortunate to build a great network there. We opened up funding in February and we raised around $200,000. So cutting it off for a little bit as we explore our pilot program and sort of see what the initial traction looks like at our first customer, which is Franciscan Hospital for Children in Brighton, Massachusetts. And then I think we'll start to readdress funding as we look to grow our company.
Right. So you guys are in beta right now with your application.
That's right. So we launched the home care version of the product August 12th, which is still in an active beta, but the enterprise product was launched mid-November, and Franciscan Hospital for Children, which just is in the process of approving our IRB, we go live April 1st, which is really exciting.
That's awesome. That's cool. So let's switch gears a little bit, and I want you to talk about the challenges that you faced when you created your company, because I think anybody who's an entrepreneur, you're going to start a company, you're going to have, I like to call them challenges, not problems. Can you talk about that? What were the biggest challenges that you faced when you were building this?
I think, transitioning from engineering to business is always difficult because, as an engineer, you're sort of trained that product can fix everything. And you want to design so that you can fix everything, but transitioning to understand how does this marketplace work, who's going to want to adopt this product is something that can be difficult, and I think it can be challenging, and I think it also being able to portray that externally is something that every entrepreneur has to do a good job of. But I think the best way to sort of combat that is to approach it like how you should design products. It's human-centered design philosophy. So, like how you approach creating product features, product design, approach that same, with the same philosophy in business, and talk with the people that are going to be purchasing your product and identify, what are your biggest problems? And can we address them? So I think it's leading with empathy has been really good for us instead of leading with product. We say, this product solves all these different things. That approach didn't work so well, but what are your big problems? And, what if we tried this? Would that work? And, that gets them a lot more excited because it's putting, their frame of mind first. It's putting them first, which is what we want to do in the first place.
Right. Yeah, you want to get out and ask a lot of questions of your target market and have them present the problems so that you can make your product a fix for them, right? I mean, we tend to want to lead with our ideas, but our ideas don't mean much if they don't solve a real person's problem. So we better get out there and ask, right?
Exactly. That's exactly it. I mean, I've seen a lot of folks just, we were in an accelerator with 128 other companies, and, the greater Boston community has a ton of startups. And you just start to see that. I mean, there's two types of companies. There's companies that really understand their market, and there's companies that build great products. And, sometimes you get the two, and those are really good. But I think understanding what your product or what your market wants, that's inevitably going to give you a really great product.
Yeah. You better know your market. Yep. So what makes your company Verbal Care different from your competitors on the market? I know you mentioned a company, Starling Health, I believe it's called, who I looked at briefly, and they look to be attacking the same problems that you guys are. Can you touch on that? Like, what separates you, or talk about your company versus your competition?
Right. So I think Starling Health's they seem to be a great company. I haven't met the guys over there yet, but I think really what we focus on, again, is this human-centered design philosophy. There's no extra features in our platform. Every single feature is designed with a specific use case in mind that was taken from a notebook, from notes that I took or any of our team members took in a conversation with, real people like nurses, patients, doctors. And I think, that is really the core for us. But from a technological standpoint, we're cloud-based. We're super flexible. It's really easy to customize our product in real time. You don't have to get on the phone with us to customize the platform. So you can do it in real time. You don't have to install any software or hardware on a server in a back room. Because we're cloud-based, it's super easy to maintain. All you need is a secure Wi-Fi network, and most hospitals already have that because of the electronic health record carts that they've already implemented. So really, we pride ourselves on the ease of use of the system. Also, I think the connectivity piece is a really massive part of it. Because we're cloud-based, you can have your family members get involved with the care. They don't have to be in the room with you to be able to communicate with that patient at the bedside. So it's a really great way to open up and connect the healthcare experience. And I don't know, maybe Starling is working on some of these features. I'm not sure, but it's something that I think really differentiates ourselves, is that everything that we designed is from the patient out and about improving their experience. I'm not saying that they don't do that, but I just say that that's what we do well.
Perfect. And what's your vision for the future for verbal care in your company?
I think the vision is really to make patients enjoy the experience of getting better. I think right now patients are not empowered to get better. Really, the only thing that they have control over is changing the television. Yes, they get to push the button, but that's the only thing that they get to do without somebody else's help. And we want to give them the opportunity to be the arbiter, sort of the champion of their own care, by allowing them to make a selection and get involved and get active and help speed things along for nurses and allow them to be better connected and better communicated with. That's really the future of verbal care, is that any way that we can better connect and empower patients is what we want to do.
Okay.
I know that's very fluffy, but if you want more nitty-gritty details, I can get into that stuff too.
All right. What's your growth strategy for scaling your business?
So I think for us, we're starting off by going directly into hospitals, because we believe that patients are going to first start engaging with the healthcare system in a hospital or a nursing home or assisted living facility. Then they might move throughout that system, but we think that that's really the first place. I mean, yes, you could also say a primary care doctor or a primary care physician would be the place to start, but we believe that a lot of people, it gets real for them in a hospital. Then from that, they've gotten used to the verbal care experience, and they want to continue with that. So we can provide discharge planning materials, educational materials through the platform that allows them to continue with the care management once they go home. So they've gotten used to using verbal care in their hospital bed. Now let's send them home. Maybe we have patient or safe patient discounts where they can say, I took my medication, it's sent into the care portal, and it allows you to say, wow, all right, I took all my meds when I was supposed to. Now maybe I should be entitled to a safe patient discount. It's really about let's get patients more involved in their care. And I think there's a lot of exciting things that I'm not going to share because we don't want to give away it all. But everything that is going to make patients healthier and happier. That's what we're doing.
Love it. Love the attitude and love the whole philosophy behind it too. So, what metrics are you guys using to measure your progress? I know you said you were in a pilot right now, right? I mean, are you guys using any sort of metrics at this point? Where are you guys at with that?
So there's a couple things that we're looking at first. I think the stage one of our pilots is really around the patient experience. So let's look at patient satisfaction and family satisfaction. Those are really our first two core metrics that we're looking at. And we're also looking at nursing satisfaction there as well. I think it's really important to have happy nurses, especially in med surgical. I know that it's not, I'm not trying to say that they're entirely correlated, but the turnover in med surg is around 16%, which is kind of crazy. So every 6 years you have an entirely new staff, basically. So that's really what we're looking at is satisfaction in sort of stage one. And then stage two is really around efficiency and being looking at completions of requests, number of interactions, things like that.
Right. Okay. So talk about, your business model that you're going to be implementing. I know you guys are in beta still, but I mean, do you have an idea of how you're going to monetize? I'm sure you do. Monetize this? I hope so.
Yeah, I know. We weren't planning on making any money.
Yeah, we'll just give it away.
Yeah, we'll give it away. I mean, I wish we could. Really, we're a software as a service company, so we're trying to make it easy. Where basically it's per bed per month cost, and it's pretty simple. So there's no extra stuff that you have to pay. It's one price per bed per month. And right now we're thinking it's probably going to be around $50 per bed per month, but that price may change. But we are offering a free pilot at this stage, at least through March. So if there's any companies or any institutions that want to get involved through March, we'd be happy to talk with them.
Perfect. Yeah. So just a basic subscription model per bed per month, very simple,
right.
Straightforward.
Right. And the prices do scale depending on the size of the institution.
Okay, perfect. Here's the last question, and before we wrap things up, I got another question for you, and it's a little bit of a doozy. So here it is. So if you woke up tomorrow,
yes,
and the Affordable Care Act added new legislation for your company, what would you want it to read?
Ooh. Honestly, I think the Affordable Care Act already does read what we want it to read around patient satisfaction. I think they could just continue to hark on that because we love. I mean, the HCAP scores. It's like our bread and butter. It's really like the first question is basically how well did your nurse communicate with you? That's what we do. We improve nurse communication, and then you look at one of the lowest scores for HCAPs is how noisy is it, basically? Is there a ton of noise on the ward? Well, if you're sending requests directly to the nurse on a mobile device and not sending it to a loud noise in the hall, well, you're going to reduce the noise because it's going right to the nurse. So, you look at some of the most important parts of the HCAP scores, and that's literally what we do. It's a byproduct of what we do. And we did it by accident. We did it because it was what patients needed. So I think if the more that the Affordable Care Act moves towards improving the overall patient experience, that's going to be great. And also, what I'd like to add is, what if we improve the experience for nurses? And maybe that's something that we can strive for, is having happier clinicians as well. So I hope that's something that we can accomplish. But I know it's more about patient care. So I think we're pretty happy with what the Affordable Care Act has done to create a market for verbal care.
Beautiful. All right. Well, Nick, thanks for coming on. Appreciate your time. Let's just wrap things up by just telling our listeners where they can find out more about you, and then we'll wrap up the interview.
Yeah, so if you want to find out more about what Verbal Care is up to, you can check out our website, verbalcare.com. Also, you can follow us on Twitter @verbalcare, and you can find us on Facebook. I think it's /verbal. And happy to talk more. Our email is contact@verbalapp.co. So feel free to reach out to us there. Happy to find some forward-thinking institutions or potentially partners that want to help improve patient experience.
Perfect. All right, Nick. Thank you so much for coming on.
Thanks for having me
today. All right, everybody. I hope you enjoyed that conversation. It was a great, informative discussion with Nick today. We'll have a archive page created for this conversation over at newwavehealthcare.com/verbalcare, probably in the next couple days. And also go over to newwavehealthcare.com, subscribe to our email list. We put out a newsletter every month that kind of has a curated list of what's new and fun in the healthcare industry. And also check us out on iTunes too. Just search the iTunes store for New Wave Healthcare, or go over to newwavehealthcare.com. Click on the iTunes symbol to listen to us on the go as well. So, hey, Everybody, hope you enjoyed that. We'll see you next time.